Well, clinical trials show us which medicine works in the fight against cancer. It's the best way to learn what helps in treating a disease. And in tonight's Eye on Cancer, IU Health Goshen Center for Cancer Care has close to 36 clinical trials taking place right now, including one for a northern Indiana man who has a rare form of cancer.
I'm not doing bad at all.
Jay Simmers was diagnosed with mantle cell lymphoma 6 years ago.
I always said if I ever had cancer, I didn't want to go through chemo. But boy, you lie. You lie.
Simmers from Kendallville, Indiana, went through chemo and treatments over 4 years for mantle cell, which most often affects men over the age of 60. He had cancer growths all over his body. And just when he was losing hope,
the doctor goes, "Do you know where Goshen is?" And I said, "Yeah." He goes, "Well, they're running a clinical trial there." So thank God I got here.
Clinical trials are crucial for identifying effective drugs and combinations for lymphoma patients. The targeted therapy, ibrutinib, is what Jay has been taking. 4 pills a day for the last 2 years to help shrink the cancer growth.
I just feel better, just almost back to what I was.
IU Health Goshen Center for Cancer Care normally has about 35 open clinical trials per year. Now, trials are sponsored by pharmaceutical companies, but a unique aspect for IU Health Goshen is having a laboratory service done in-house. It takes an average of about 8 years from the time a cancer drug enters clinical trials until it's approved.
No, none of that.
And for Jay Simmers, this clinical trial is helping him as he tries to nip cancer in the bud.
When you wake up and you know you can see the sunrise and you see the sunset and you see your kids and your grandkids, that's what keeps you going.
Yeah, Simmers has been part of the clinical trial for almost 2 years now. On average, a new cancer drug has at least 6 years of research behind it before it even makes it to clinical trials. And we put more information about clinical trials on our website. Just look for this story in the Eye on Cancer section of our website at WSBT.com.